The juvenile onset is only released in Keysons, maybe, say, in our experience, Labradors. Does pancreatitis cause diabetes? The answer is yes, it can. It's not common. But again, Penny Watson's work at Cambridge has clearly shown that now, that if you have recurrent chronic grumbling pancreatitis, probably only in dogs, not been proven in cats. So it's not been published. I personally think it's only a matter of time before we find it. I think the challenge in or the difference in cats and dogs is that feline pancreatitis is almost always due to bacterial infection. So it's part of the cholangiohepatitis complex. So the current ideas on pancreatitis, here we're going to a different time. Ideas of pancreatitis in cats at the moment are as follows. You can have triaditis, so cholangiohepatitis, pancreatitis and inflammatory bowel disease almost certainly exists as a definitive disease complex. But the primary underlying primary pathology is inflammatory bowel disease. And you have deficiencies in the Treg cells in the mucosa of the small intestine, and it allows bacterial translocation across the gut wall. So I don't know what you would talk about. At vet school, and even at Cambridge, 20 years ago, we were teaching students cholangiohepatitis in cats is an ascending infection up the common bile duct of the gut flora, because a cat's got a common bile duct, so it's bigger. But if you look at histopathological samples from cats with cholangiohepatitis, if that story was true, you'd find the bacterial foci around the bile caniculae. Actually, you find bacterial infection evidence across the whole liver. So not just around the bile caniculae, it's across the whole liver. So that's led, Kenny Simpson in Cornell is the guy who's driving this work. If you ever get a chance to speak, hear Kenny speak at BSAVA, he's absolutely brilliant. What he doesn't know about GI isn't worth knowing. So, and what he's shown now is that Treg function in cats with IBD is diminished. And that has two effects. You get uncontrolled inflammation, which we'd see as IBD, inflammatory bowel disease. You get leakiness in the tight junction across the mucosal surface, and you get bacterial translocation from the gut into the bloodstream, which goes straight to the liver. The liver will then the liver is fundamentally a huge lymphoid organ, as amongst its other things, so it will filter those bacteria out, but there is a chance over time you're going to get some E. coli or Klebsiella that will set itself up. That will then either be within the liver and cause a bacterial hepatitis. More commonly, it will go into the gallbladder and cause a cholangiohepatitis. Because the pancreas and the liver share common venous drainage, you can get translocation into the pancreas as well. So that is most cases of pancreatitis in the cat actually need treatment with antibiotics. My argument with dogs, this is not the time today, but antibiotics in dogs with pancreatitis are absolutely not indicated and probably contraindicated. You do not need antibiotics in a pancreatitis patient in a dog. In cat, it's mandatory. So the reason that's going through that spiel is important is cats, if you control the underlying IBD, cats rarely get chronic pancreatitis. Dogs, it's a different kettle of fish. We don't know what causes pancreatitis in dogs, and it's not the same as humans. And the reason we say that is if you look at the statistics in humans, acute pancreatitis, we know it's associated with high fat intake, we know it's associated with obesity, we know it's associated with alcohol intake. So joking aside, Boxing Day is one of the commonest days to have be acute pancreatitis admissions in a human hospital. There's the theory in our patients that hyperlipidemia causes pancreatitis, but that's because schnauzers are naturally hyperlipidemic, and schnauzers something like about 5% risk of the average miniature schnauzer and giant schnauzer getting pancreatitis its lifetime. But that is probably a breed-specific issue, because most of the dogs we see with pancreatitis are the small breed terriers, and it could be anything. And they're not hyperlipidemic, they're not overweight. So canine pancreatitis is probably a problem where, number one, the enzymes, if you remember going back to pancreatic physiology, all of the digestive enzymes have a protective cap over the enzyme surface that is broken down by trypsin, and trypsin is only produced by the small intestine. So when the pancreas releases enzymes, in theory they're all inactive, they hit the duodenum, trypsin in the duodenum takes off the protective cap, exposes the active element of the enzyme, and that then allows them to do their digestive function. So it's one of those protection mechanisms. And the second protection mechanism of the pancreas is all the enzymes are stored in these little granules called zymogen granules. What probably happens in canine pancreatitis is, number one, the zymogen granules are unstable, so they can break down and release without there being a digestive stimulus. And secondly, we're either making trypsin in the pancreas when we shouldn't be, or the enzymes are made in an active form. So canine pancreatitis is, and there's probably varying, it's 3 or 4 types of pancreatitis. But the issue with canine pancreatitis is it's much more common to see chronic grumbling, subclinical, with acute flare-ups, but there's chronic grumbling inflammation all the time, and that is different therefore to the cat. And if you have chronic grumbling pancreatitis and you end up with some fibrosis, that is the thing that will drive you to have a lower number of beta islets and become diabetic. So I suspect there will be cats out there, of course there will, absolutely. But the pathophysiology of pancreatitis in dogs, different to pathophysiology of pancreatitis in cats, and that's probably why we're getting some differences.